Hello, viewers. Today we have with us Dr. Reema Goswami. She is the head of the Department of ENT at Bundelkhand Medical College in Sagar. And we also have a student, Dr. Madhu Sharma. And both the doctors have developed a new app to help tracheostomized patients communicate. And they'll be talking to us about this very app. So, welcome, doctors.
Uh, Tracheostomy is actually a procedure where you make a hole in the trachea, and it is used in it's an emergency procedure. Emergency procedure, it can be an elective procedure also. So in cases of upper airway obstruction, you want to overcome that obstruction, and you bypass the upper airway obstruction. Now when we talk of the upper airway obstruction, we mean the nose, the pharynx, the oral cavity, and the larynx. So we make a stoma into the trachea. As it bypasses the upper airway obstruction, you're breathing directly through the, and the air goes inside the lungs through the trachea. Now there are many indications, and one of the important indication in India is the cancer of the head and neck region, which includes cancer of the nose, the sinuses, the larynx, the oral cavity. So it can be these huge lesions, huge cancers are obstructing the airway. So to overcome that obstruction, we make a stoma. This is one of the common indication of tracheostomy in India, but otherwise you have many other indications. The other can be you are having a congenital stenosis of the larynx, means the narrowing of the larynx which is present at birth, or it can be a road traffic accident where you want to prevent the aspiration of blood into the larynx, into the lungs. So, and you can have a patient with respiratory failure also, and the patient is not being able to cough out his secretion. Then you make a stoma in the larynx, or you can have a patient on the ventilator and a prolonged ventilation. We make a tracheostomy and then connect it to the ventilator. So these are the various indications for a tracheostomy, most of them. And but as an emergency procedure, we do the process, we do the procedure, we are happy that we've saved the patient. But as a sequel, the patient loses his voice. This is because the expired air is not being conveyed to the vocal cords. So it's not going to cause the vibrations of the vocal cords. So you have bypassed the vocal cords. Now your air is going directly through the stoma. So the problem is that we do this procedure, and we are in a hurry to do the procedure. We act after the procedure, the patient loses his speech, he can't communicate. Now the problem with such a patient is that he is in pain, he's had an important surgery, he's already having an underlying pathology. So if you ask him to write down things and talk about his needs, it's very difficult. So seeing this, my student, she also had a lot of queries about how do we help the patient. So we developed an app, and this is the first type of app which we have developed where the patient does not have to type anything. He can click on certain pictures. So now Dr. Madhu will tell you her experience and how she came about making this app.
So there were a lot of tracheostomy patients who were admitted in our ward, and I saw that they were not able to speak and they were not able to express their complaints or their needs properly, either due to their pain, or many of our patients were also not able to write due to being illiterate. So even though we provided them pen or paper, it was of not much of use for them. So I thought that the patient is in a lot of mental agony because of this, and their attendants are also very much in mental distress. We were also we also took a lot of time to understand their complaints, and this somehow affected their proper care. So I discussed it with our head of department and Professor Dr. Reema ma'am that what can we do about this. And so the idea of app was initiated, given by Dr. Reema ma'am. And then I discussed this with a friend of mine who is a software developer. So he said that yes, we can develop an app. I provided him the input, and then we developed this app. So I will show you this app. Uh, as you can see, this is the logo of the app. If we click on this app, um, the first page will be open, and here there is a buzzer present. So the patient just has to click on this, and a sound will be produced. So anybody who is nearby can come to the patient without the patient calling them. And here is also a well-being score present, so that the well-being of the patient can be marked up out of 10. As we can see that there are many scores, like at 4 it is written that चीजों से बच रहा है पर हालत बिगड़ रही है. So if पुष्टि करें पे हम we will click on the पुष्टि करें, then any doctor who comes later on, they can see and they can ask the patient about their complaints and solve it. Then we come to the next phase, where is the needs of the patient. Here the first one is dard ho raha hai. As we can see, there are motion pictures also present, and it is also written here dard ho raha hai. So patient will have to just click on this, and a sound will be produced saying dard ho raha hai. So the patient does not have to write, and the attendant or the caregiver will have no problem understanding the complaint. If the patient then clicks on it is color coded, yes or no is given here. If the patient clicks on green, that means yes. So the complaint will be come here. The complaint will be shown here in block letters, and it will also be recorded here in this in the first page as the dard ho raha hai. So if suppose there is no attendant present at that time with the patient, then also the patient can record his complaint, and later on either the attendant or the doctor can come and see this complaint, and then and then solve it. So we have multiple complaints, like first is about pain, second is about shortness of breath, and third is anxiousness, then difficulty in swallowing, then about itching, constipation, fever, urinary problems related to micturition. Then if any ulcer is present, because a lot of patients are bedridden, so a lot of patients are bedridden, so they develop bed sores, and this is very much get ignored when the while patient care is being done. And then there are certain common day-to-day needs like sitting, then about drinking water, about eating food, if the patient wants to walk or not, or if the patient wants to sleep.
So this is an app which has been developed, and the important thing that this is an app which is in Hindi, and it can be used by all patients including children, because there are many indications of tracheostomy which we have, which is done for children also. They do tracheostomy, especially the congenital cases, that is from birth they have narrowing of the airway. So in that case also tracheostomy is done. Also, we won't tell this is only for tracheostomy patients. They can also be used for patients who have stroke or who have paralysis. So also these such patients also in the ICU are not able to communicate. In all these patients, we have this very basic app which we have made.
What time did you think of developing this app? Like, and how much time did it take you to actually make one? How much time did it take?
This problem, it came to my mind even during my residency. There was one case where we did a tracheostomy, and because the patient was in severe respiratory distress, And
Hmm.
as enthusiastic residents, we took the patient for surgery and we did the tracheostomy, but we didn't explain to the patient about how he is going to lose his voice. So then I found after the operation, the patient's attendants were more worried, that they didn't think that he was saved. They felt that he's lost his voice. So this was one thing I noticed, that patients become very anxious losing your voice. Obviously,
Hmm.
if you suddenly next day you wake up and you don't have a voice, that's a problem.
Hmm.
Then that was my residency, and then there was Dr. Madhu, who is now our generation, the younger generation. She came up with the same problem, and she asked me how to go about things now. So then we were having a conference in Indore, and she was having a poster presentation. So I said, why don't
Hmm.
we develop an app now, and we'll present it in the conference. So that was how,
Hmm.
that was the time we decided, let's develop an app. So that
Hmm.
is how we decided. It took
How?
around
Huh.
1 month. We haven't yet
Acha.
put it on Google Store, Play Store. We
Okay.
haven't put it on Play Store.
Uh-huh. Okay. So what's the reason? It's a free app, I guess.
Yeah, it's right now it's a free app. It's an APK,
Hmm.
but we want to
Hmm.
develop it further. We
Hmm.
felt that yes, we should have it multilingual, not only in Hindi. There are so
Hmm.
many languages other than that. So then there is,
Hmm.
this was just a trial on around 5 patients, and we want to
Okay.
continue this trial for some time, and then try
Hmm.
to improvise on what we've made.
Okay. So as of now, we have only Hindi language there, not even
Yes,
English.
yes. No, no, not English. And to tell you the truth, all our patients are from
Huh?
rural areas, and there is
Hmm.
an app in English, but it's a typing
Hmm.
app. You type it, and
Hmm.
then there's a speech. It's not like this way,
Hmm.
it's just a typing app. So that is the other
Hmm.
app which is there.
Hmm. Hmm. But then, like tracheostomy patients are there everywhere,
Yes, yes.
no?
Yeah,
So
yeah.
don't you think that simultaneously at least two major languages of India you should have it in
Yeah, yeah, sure.
Hindi
We
and
should
English?
have it in English. Yes, yeah, we should have
Huh?
it. We were thinking about
Huh?
it. We are trying out on
Hmm.
our patients what is the response, and then we'll have it on the other
Hmm.
patients also. We'll try. That's
Hmm.
what I felt, that yes, it. That's why I said we are now on our. It's just the initial. It's a prototype,
It's
you
just
can
huh.
say.
Huh.
It's a
So it's
prototype
just the
now.
beginning. There's a long journey to
Yeah,
go.
yeah. And then
So
we'll end up
eventually
with
you'll
the
have an
iOS. We want
okay.
to have it
Okay.
in the iOS. That's what.
Okay. And how are the patients taking it?
Yeah, they're
Do
responding
you
well. Yeah,
hmm?
obviously they are responding well with this app.
So, see, one thing is that they're able to communicate, but has the app made any difference in their mental health? Because I feel mental health is the first thing that gets affected when a person is unable to speak, communicate verbally. So, have you seen that patients are now maybe a little marginally more content
Yes,
or
yes.
happy or something?
Yeah,
Hmm.
Madhu will reply that she is the doctor on duty
Hmm.
nowadays. She's a
Hmm.
junior, so she'll
Okay.
tell that. Huh? Huh.
Okay. Huh.
Yes, they are
Madhu?
more
Madhu?
satisfied with their whatever their treatment is going on. They are very much able
Hmm.
to uh, tell us about their complaints without much of
Hmm.
hassle, and also the time
Hmm.
taken to understand what they are undergoing has lessened. So yes, they are very much satisfied with the response.
Okay. Okay. So, Dr. Reema, this tracheostomy, you said that there are different cancers of
Yeah.
oral cancers where you need to perform. There are, I
Uh,
think, stroke cases
yeah, stroke
where
cases.
tracheostomy.
Yeah, definitely. Stroke cases also, you
Huh.
have patients with laryngeal paralysis, and also you have very much
Hmm.
debilitated patients. At times, you
Hmm.
if you go in the ward, you find many old debilitated patients who are not being able to speak what their complaints. And in the OPD also,
Okay.
we have certain patients who bring big letters to us, and then you have a big rush, and we feel that we are not being able to understand. And if you have a ward and you have nursing staff, and with all the pressure and all the workload, I think they don't give enough of time. So this is,
Mm,
we felt this is a very pivotal role it's going to play in the initial care
mm,
of a patient in the
mm,
ICU. Later on, there are
mm,
certain other prostheses, speaking prostheses. Those are
mhm,
called there are certain
mhm.
speaking prostheses where you connect the trachea to the esophagus. So now the air goes
Okay.
into the esophagus and the patient can speak,
Mm,
though it will not be that clear, the speech, but still there are speaking prostheses. So that is the
okay.
reason.
So that means this tracheostomy that you do, it's is it a temporary measure?
No, tracheostomy can
Tem-
be a temporary or a permanent. So
Okay.
if you take a
Okay.
patient like there are
Mm,
many actors and all, who have were in the
mhm,
ventilator for a long time. So in
mhm,
all those patients, if you
mhm,
have a very prolonged in the ventilator, the patient has to be. So in all
mm,
multi-speciality hospitals, it has become a norm within 7 days you're changing over to a tracheostomy if you're
mhm,
expecting your patient to come out of the ventilator in the ventilator. Then there are other cases like suppose you have, so in that patient it's just a temporary tracheostomy. If you are expecting your
okay.
patient to come out of the ventilator, you can say it's a temporary tracheostomy. Now if you have a cancer larynx
Okay.
patient, you are going to remove the whole of the larynx, so now you're going to have a
Okay.
permanent tracheostomy. So it depends on the
Okay.
pathology what you are having. So if usually cancer
Okay.
patients, we go for a permanent tracheostomy.
Okay. And are there many, the cases are very large coming to cancer. Uh, what is the incidence of the number of cases? Has it increased over the years?
Yeah, it has increased, especially in our side. We can say it's even come to the younger age group because gutka is sold everywhere, near all
Hmm.
schools, everywhere
Hmm.
gutka is sold. So the now which we
Hmm.
used to get before 50, 60 years, and even ladies,
Hmm.
it's very common out here that ladies are also coming up with
Hmm.
oral cancers, laryngeal cancers. So the whole in
Hmm.
our belt, Bundelkhand region,
Hmm.
this was an area where you get these tendu leaves, and BD was made
Hmm.
out here initially. So this is one belt
Hmm.
where BD
Hmm.
started out here. So then
Hmm.
you have lots of people with lot of addiction out here. It's not only
Hmm.
here, but I was reading
Hmm.
the most head and neck
Hmm.
cancers are in the northeast region in India.
Okay.
Suppose you say if it
Hmm.
is 25 per 1 lakh in whole India, it is 31
Hmm.
in northeast region. So that much is the difference in the northeast region. So it's
Hmm.
related to
So,
smoking and it's related to the betel nut chewing and gutka pan masala.
okay. Okay. And this app is going to be helping them all.
Yeah, it is going to help our patients to communicate, but not to
Hmm.
eradicate any sort of
Hmm.
cancer. That is going, that has to
Uh,
be done by the
hmm.
big people, not us. I
Yeah.
think so.
Yeah.
Yeah.
But as doctors, what do you do? What steps do you take
Yeah,
uh,
we've in
to?
all the regions nowadays as doctors, we have an initial screening for the head neck cancers. So as the
Hmm.
patient comes, we all patients we take the proper history and then we
Hmm.
screen them. Screen means we do a proper examination with the endoscopes, and then if any suspicious lesion is there, then we take their biopsy and send it. So this is an early intervention, early treatment where you detect it early.
Okay. So that these tracheostomy could be avoided.
Yes, surely. If you are
Hmm.
tracheostomy is when the bulk of the disease is so much and it has also affected the larynx, it's
Hmm.
causing a mechanical obstruction or it has invaded the laryngeal nerve. So then you can have a
Hmm.
patient who is going to have a complete obstruction of the airway. So in that
Hmm.
cases, we should do we can initial radiotherapy, chemotherapy, or surgery depends on the site. We can
Hmm.
prevent a tracheostomy.
Okay. ठीक है. Anything else would you like to tell us about the new app? or are there other issues that you come across about those also, which if you're thinking about developing, having some techno solutions?
Uh, Other things we can think is, one is the deaf and mute people. Deaf and mute people, yes, there are certain apps, but they are using these certain what you call these using their fingers to, that is the speech which they use, no? But with that, them also we can have an app. It will be easy for them, for the deaf and mute people. That will be good for them. And this is also for the children. For children, it's a problem for the mothers to understand, especially autistic children. So you can give them their initial audio visual training. So that will be again very, it will be how to develop that.
So we can hope another app coming from you guys.
Let's complete this, and then we will, yes, once we've got into this, we should think of other things.
And tell me, by when do you think you'll be able to put it on this thing, Play Store, Google Play Store, or Indus App Store? Yeah.
Google
it's
Play
when
Store,
finally ready.
Google Play Store, I think so. Within 2 months, we should be able to put it. We are just going through the procedure. I think Google Play Store will put it easily. iOS has a number of tests, you know that. So that is going to take some time.
Some more time.
And plus, I'm talking to some more engineers how to make it multilingual. English, turning it into English is not going to be a problem. I think that is not going to be a problem. To make it multilingual, it's other than English and other languages. That's going to take time.
Yeah. So we can hope that in say 2 or maybe 3 months, you will have the app on the Play Store and in English and Hindi.
Yeah. It's already in Hindi.
Can I say that?
Yeah. It's in Hindi, but in English, English we'll have it soon.
On Play Store?
Yeah.
Okay. So I wish you all the best, Dr. Reema and Dr. Madhu.
Thank you.
And may you keep on developing more such technical
now
solutions
that we've
for
got
your
a
patients,
young generation of people, all the new people coming up. So then we have the gap which was there as now reduced. We have these young PG students who they understand the technology better than us. So we just convey our ideas, and they can improvise on those ideas they can do.
Yeah. So I wish you all the best.
Okay.
And thank you so much for talking to us.
Okay. Thank you.
Thank you.
Thank you.
Okay.